How will be future IVF treatments? IVF science has advanced dramatically in recent years, with several promising frontiers emerging across biology, technology, and personalized medicine. Genetic and molecular innovations, pre-implantation, genetic testing, PGTA, PGTM. Testing embryos for chromosomal abnormalities before transfer significantly reduces miscarriage rates and improves live birth rates, especially in older patients. Next-generation sequencing has made this faster and more precise. Non-invasive embryo testing, NIPGT. Rather than biopsying the embryo itself, scientists can analyze DNA shed into the culture medium, a potentially safer alternative that avoids any physical disruption to the embryo. Mitochondrial replacement therapy, MRT. For women with mitochondrial disease, transferring the nuclear DNA into a donor egg with healthy mitochondria, three-parent IVF, addresses both genetic disease and age-related egg quality decline. AI and technology-driven approaches. AI-powered embryo selection. Machine learning models trained on thousands of embryo images and outcomes can now predict implantation potential more accurately than experienced embryologists, removing human subjectivity. Time-lapse incubators, EmbryoScope. Continuous monitoring of embryo development without removing them from stable incubation conditions allows better selection based on developmental timing and morphokinetics. Digital twins for treatment simulation. Emerging platforms model individual patient physiology to simulate how they'll respond to different stimulation protocols, enabling personalized dosing before treatment begins. Uterine and implantation innovations. Endometrial receptivity analysis, ERA test. Genetic profiling of the uterine lining identifies the precise window of implantation, allowing embryo transfers to be timed with far greater precision, reducing failed cycles due to timing errors. Platelet-rich plasma, PRP therapy. Infusing the uterus with PRP, derived from the patient's own blood, appears to improve endometrial thickness and receptivity in patients with thin linings or recurrent implantation failure. Uterine microbiome optimization. Research links specific bacterial profiles in the uterine cavity, particularly Lactobacillus dominans, to better implantation rates. Microbiome testing and targeted probiotics are an active area of investigation. Egg and sperm quality improvements, in vitro maturation, IVM. Maturing immature eggs in the lab reduces the need for high-dose hormonal stimulation, making IVF safer for women with PCOS or at risk for ovarian hyperstimulation syndrome, OHSS. Oxidative stress reduction. Antioxidant-enriched culture media and lifestyle interventions, CoQ10, melatonin, are being studied to protect eggs and sperm from oxidative damage during and before the IVF cycle. Sperm DNA fragmentation testing. Going beyond standard semen analysis, testing for DNA damage in sperm helps identify cases where ICSI with selected sperm, physiological ICSI, PIXI, may significantly improve outcomes. Emerging and experimental frontiers. Innovation stage, potential impact, artificial ovaries for cancer survivors. Clinical trials, preserves fertility after chemotherapy. In vitro gametogenesis, IVG. Early research, creating eggs, sperm from skin cells. Organoid endometrial models, research testing. Implantation without animal models. CRISPR embryo correction. Experimental fixing, single gene disorders, pre-implantation, womb on a chip, research. Mimicking implantation, environment in vitro. Holistic and systemic factors. Personalized stimulation protocols based on AMH, antral follicle count, and genetic markers reduce over-under response. Stress reduction programs, mindfulness, acupuncture, show modest but real improvements in outcomes. Nutritional optimization. Mediterranean diet adherence is associated with higher live birth rates. Sleep and circadian rhythm management during cycles is an underexplored but promising area. The field is rapidly moving toward highly individualized, data-driven IVF, where protocols are tailored not just to age or diagnosis, but to genomic, microbiome, hormonal, and behavioral profiles of each patient. The goal is fewer cycles, fewer losses, and healthier babies.